I'm going to change a little bit now to touch on no deal planning, and as you know, these webinars are supported by the Business Readiness Fund. The ask of government is for businesses to be ready for no deal, but a couple of points from me before we go to our government expert who's joined us today, and then into some questions. Yellowhammer is an incisive document. It's the government's analysis of what would happen in no deal, and it clearly states that that government expect business readiness for no deal to be differential and likely to be not perfect across the piece. So public and business readiness for no deal will remain at a low level. Readiness will be further limited by increased EU exit fatigue, which I know none of you have got at 4 o'clock on a Friday afternoon when you're deep into a Brexit webinar. Business readiness will not be uniform. Larger businesses across sectors are more likely to have better developed contingency plans than small and medium-sized businesses. I think that's reflected in my analysis amongst BIA members, and it's impacted by the nature of the businesses that are involved. So although they're asking us to be ready, there's a realistic understanding that not everybody will. Yellowhammer, the government's analysis of where the UK would be, is also instructive on what will happen in terms of disruption, particularly at Channel Straits. 40% flow rate could be as low as 40%, with significant disrupting lasting up to 6 months. Unmitigated, this will have an impact on supply of medicines and medical supplies. And that's why we have spent so much time with colleagues across the sector working on this. And David may touch on this later, but you can see that there is an understanding, and I'm sure we won't be asking the swimmer to do a few more trips across the channel. And there was a new report this week from the National Audit Office, which looked at exiting the EU and believed, although much had been done, there was significant work to do, highlighted the risk of delays, looked at particularly the new issue of the readiness in the social care sector and nursing homes, the need to put in place sufficient freight capacity, and said time available to put capacity in place is extremely limited, and it might not now be possible to have all the freight capacity available on that date. So important developments there. Another thing we've seen, just for information this week, is you've seen the government act on industry advice to address shortages by restricting parallel export of certain categories of drugs to ensure those supplies are best able to be used for UK patients, and it's another factor we should have in the thinking as we prepare for no deal. So the government, in a sense, has taken a move to disrupt the normal course of business in terms of parallel import-export around concerns around particular groups of medicine, with a new power that was taken very recently. They've actually actioned that this week. The government recommends on no deal that, in simple terms, you focus on these areas. Go to gov.uk for information relevant to your business. Have a look at tariffs your business may face. Look at borders issues, customs and VAT. Make sure you understand what regulations you need to do if you're selling medical products to UK or EEA, and make sure your staff and team are able to continue with the right to work with some new paperwork there. We've been doing events on this week, and I suppose my quick take on this is that there is a prioritisation that you can do through this. I think going through the quick 7 questions at the beginning is useful, and many people have found that sort of helping and focus them on what they need to care about. Tariffs is a difficult one, although the tariff rates are published for much of our sector, and much of it is 0 for 0. There is some devil in the detail on certain things that are not finished pharmaceuticals, and of course the EU haven't published their tariffs, and it's one of the things that could potentially change. We've seen the impact of tariffs this week in general, the EU tariffs and the US in relation to aerospace and whiskey, and the impact that's had on share prices. These can be important, but I think it's a difficult one to do much about. There is a document there, but it could change, and you don't know the EU side of it. If you're going across the border, the new stuff there and the HMRC's information on this is important. I think this is probably the most important one at the moment, because if you've got something turning up at a port, it needs to have the right paperwork, and that paperwork needs to be in the hands of the driver. Logistics businesses, it's their bread and butter to do this, but there is a big change to lots of this, and they do need some things from you, and you probably need to make sure that you've got this sorted. EORI numbers, TSPs, David may touch on this a bit later. And of course, we are awaiting details of the government procured contingency supply for medicines. Again, I know people are pestering for this. I don't have it at the moment, but I know if you're engaged with the Department of Health's programme, they have it front and centre as to the things that they're looking to do. Medical regulations, my sense is that the MHRA and the EMA have been pretty detailed about this and how it's going to work, and much of this guidance has been available for many months. It's available on websites. There's an area on our website, and the MHRA website is pretty good. There's some good explainers. My sense is that many companies are sort of through the bulk of this in terms of how they're going to approach it for day one, and obviously the derogations in terms of the MHRA accepting things from the EMA make things far easier, at least in the short term. And we found in face-to-face meetings that many of the questions around people, continued right to work. I suppose the difficult thing here is that not all of these positions are enshrined in statute. So although there are some processes and some people have found them straightforward to operate in, there is not absolute legal certainty, and we've seen that layered over with some differential thoughts from government about positive thoughts about how things could be easier for scientists and others in our sector, but those yet haven't gone much beyond being paper stories. There may be the intent there, but there's not legislation, there's not visa regimes you can go to. So that's a little bit about how we are very rapidly thinking about these. As I say, we're conducting a Brexit readiness program. You're on a webinar. We've got the portal, we've got clinics, we've got expert views, we've got web resources, we've got Q&As. I think they are all available, and thank you for engaging. Feedback on this is really useful. We've broken it up into Reg and IP, Customs, Tax and Trade, R&D and Funding, and People in Employment. But there isn't key information on everything available, and it remains dynamic. But BIA Brexit portal is the place to go from our perspective. Number of events, if you're in the north or you know colleagues are in the north, lots of those going on next week with Bio Now and Leeds, Manchester, Newcastle and Liverpool. It's a bigger tour than Oasis are doing this year. And obviously you're on the webinar. We'll do another one of these next week. The big date for your diary should be the Bioscience Forum on the 17th. We hope there to be able to pull together in London a good set of experts and sort of where we're at. That will be very close on the European Council. So if you want to discuss with peers, meet the experts, we're driving people towards that. And then if there are things that are going to happen and we are days away, the 29th of October will be our sort of catch-all readiness webinar. And after the 10th, we'll go to Cardiff for a Medi Wales event on the 24th, and we're hoping to do something in Scotland as well before the season is out. All of these details are on our website. If you've got any thoughts, we really welcome feedback on this and additional clarity where ready. And before I go to David, I'm going to ask you to just do the poll again. So with the magic of technology, please get your fingers on buzzers as we ask you again, having heard a quick rush through that, has your opinion changed? Do you think we're going to leave with no deal? Do you think we're going to leave with a deal? Or do you think there's going to be a delay? I didn't write down the result last time round. Did anybody write it down? Because I'm going to have to see if it's changed, and that's rather foolish.
It was 77, wasn't it?
Was it 77? Yeah, 3/4 were delay last time round. I shouldn't say that during your voting because that would bias the opinion I've now done.
Do we really care, Steve?
Well, we do care a bit. But let's see where you are this time around. I'm going to take 5, 4, 3, 2, 1 in 5, 4, 3, 2, 1. Thank you very much for your time on that. Now we're looking at 16% say no deal, 11% say deal, 74% expecting delay. So that tells you where your colleagues are, and I don't think you've moved much from our mad musings in the last 15 minutes, but I hope you're better in. So, sorry, 20% no deal, 7% deal was the last, was this, so So you have gone a little bit towards
Deal.
towards deal and delay.
Not sure. The statistician in me wonders whether that's a significant shift or not, but it's all interesting insight, isn't it?
It's the best we can do at rapid speed.
Yeah.
Now, before I bring David in, who's got a couple of slides, and I'm going to do one more quiz, and the last quiz poll is this one. And David, I hope you'll find this useful. I'll give you the data before we go. Have you filled in, or have you used the government's 7 questions tool on their gov.uk/Brexit site as part of your business planning for Brexit? And there's no right answer to this, and there's no wrong answer. Yes, no, or I didn't know about it. That will be. Let's see where we're at on that. People are voting. Thank you very much. It's like Eurovision. It's fantastic.
Yeah.
Or Strictly.
Are you Graham Norton or I?
I'm Terry Wogan. Okay, last 10 seconds on this one. Thank you for your contributions. So, David, as a setup for you on the government's 7 questions, I think we have not as many people voting this time as last time. 21% have said yes, they've used the tool. 36% haven't used the tool, and 43% didn't know about the tool. So I hope we'll have changed that in the next 5 minutes. So David, with that, I'm going to move the slides on and over to you, David.
Great, thank you very much. Firstly, just wanted to say thanks for the BIA for the invite, and in particular to Steve for his ongoing support and challenge throughout the programme. It is very welcome. Also, thank you to BIA members for all your efforts. We know that this is an uncertain time. There's lots of burden on you, but the engagement is really positive. If I can make one plug, I know probably most people are in the medicine space, but if there are any clinical trial sponsors that have not responded to the clinical trial survey, please do so, as that one is a little further behind on that, to just give that plug. I have 2 very brief slides because I wanted to go through 2 things today. One is just to give a brief overview of the programme, which I hope is not new to anyone, but it feels wise to do that. And then I will update on a couple of specific areas, in particular some things that happened this week and things that will happen next week. So to the slides first. The first one is just showing that the Continuity of Supply programme covers 6 areas. These are medicines, medical devices and clinical consumables, clinical trials, vaccines and countermeasures, blood and transplant, and another area called non-clinical goods and services, which picks up items such as laundry, food, clinical waste that help the health and care system to work. So that is the kind of breadth of the programme, and we've done that to try and just capture every single element that helps that kind of makes the health and social care system work. Workforce is obviously not in there. That's not directly within the programme, but of course it is hugely important and picked up by colleagues in the department. Moving on to the next slide, and again, hopefully this isn't news to you. Very similar to what we did in terms of March, we have a multi-layered plan. This was communicated in a letter from Steve Oldfield on the 26th of June. So the multi-layered plan consists of stockpiling, of rerouting, of warehousing. So government has provided capital to bring online additional warehousing, changing and updating regulatory requirements. So that is things like the UK will continue to recognise batch testing and release from the European Union. The National Supply Disruption Response, which is essentially the system that if there are shortages post-Brexit, building on the existing systems that we use, but making sure that that has the capacity and is joined up across the programme to act as it may need to. And the 6th one is trader readiness, which Steve has talked a little bit about, which is essentially getting all of your paperwork ready for any new customs processes that may come into place. I think it's worth saying, just highlighting that the multi-layered approach has been done in a sense because it gives us that flexibility that every single aspect of this plan does not need to be at full pelt at all times. So if the government secured freight, if everything could flow in as it does today, then effectively you wouldn't need a stockpile. The stockpiles essentially provide us with that little bit of coverage in case the freight is not all online from the beginning. To update on a couple of things that have happened this week. Firstly, the freight is obviously something we get a lot of questions on. So there are two different types of freight that the government is procuring. There is the express freight service. This is being procured by the department itself, and it has 3 lots within it. So there are next day deliveries for parcels, 2 to 4 day delivery for pallets, and then special service for direct, bespoke and special deliveries, which can accommodate things like medical radioisotopes. So that one is run by the Department of Health and Social Care. The invitation to tender has been enclosed. We've assessed the bids, and we should be able to announce the outcome of that in the next week or so. That one is entirely on track to be up and running, and it will be tested ahead of the 31st of October. The second one is the DFT-led procurement. So on this one, invitation to tenders have open and closed for the framework. So how this one works is that a number of companies have bid successfully to be on a framework that concluded on the 20th of September, and it's got 8 firms on it, the usual ones that you would expect, like Brittany, P&O, etc. Once they are on that framework, on the same day, a call-off was launched. So the call-off essentially is government saying, we require this amount of capacity for a no-deal Brexit. So health, all medicines and medical products are prioritised on those shipping routes. We represent 91% of the entire capacity. The bids on the call-off have closed. They're closed on the 1st of October, and they are currently being assessed. So we will be able to announce the results of those, including the all-important routes, in mid-October. The other thing in relation to the freight is that we will shortly be writing out to all market authorization holders a letter from Steve Oldfield to provide an update. This will include details of how to register for these 2 freight options. Obviously, the express freight service is a registration but is in control of the department. So essentially we decide what goes on that freight based on clinical need through input from the NHS. The DFT procurement is for roll-on, roll-off ferry services, which will be booked by yourselves. So the letter that will come out early next week will tell you how to register for both of those. The letter will also include the launch of a trader readiness unit. So to help all suppliers to get their heads around and get themselves trader ready, we have secured dedicated resource for that. So it will be a managed inbox, essentially to deal with any queries you have in terms of new customs procedures, EORI numbers, TSPs, etc., to really just provide that bespoke support specifically for the health and social care sector. That will also be launched in the letter of next week, and that should be in the first half of the week. That was a brief canter through. I find the question and answer is usually the more useful sections of these, so I will be quiet and happy to invite any questions.
David, thank you very much. And given that this webinar may hang around online for a couple of weeks with people dipping in. I think you have given a very clear analysis there. The way I think about this is many companies have engaged already in surveys from the department around access to medicines. It's clear now that basically you'll be invited, if you've been involved in those processes, to be a member of Ferry Club fairly soon. And once you're a member of Ferry Club, you'll then be given details of what ferries are available, and then you can choose to book on them if you want to. Now, we know that that's coming quite close up against the deadline. We've made representations, I think would be the polite term, to government about the challenge that this puts companies under, because it means you've got to do it in very short order if you're trying to get stuff through in the early weeks of November, because if it means a change in routing, it's one thing to roll up to Calais and then get on the next thing, which will go every sort of 10 minutes. It's a different thing if there's two a day and you've got to hit a slot, and that may have implications for your drivers, your temperature control and all the rest of it. But I know people are ready and waiting for this. Some companies have already fundamentally moved, but quite a lot, I think, are from anecdotal discussions with BIA members, are waiting for the government procured things to be available. We know that they're coming. We know they're not there yet, but we know that there's steps that companies need to take, i.e. you need to say, yes, I'm interested, please have me on the list for Ferry Club, and then that will give you the capacity to then to book on particular things as they come available. Is that fair, David? Is that sort of a simplistic term?
Yes. So registration, instructions on registration will be next week. Then the routes will come out, and then the tickets will become available. Those are the 3 steps over the next few weeks.
Thank you. So I'm going to open it up to questions. If people have got questions, please type them in. They can be around trader readiness. They can be around anything you've heard. Do tariffs apply only to goods? Are tariffs applied to goods that are transported but not for sale, e.g. blood samples? Anyone want to have a go at that one? David, have you had that one before?
I've not had that one before, and I can promise to get back to you on it, but I wouldn't want to give an answer now because I'm not 100% sure.
Yeah, I mean, my perspective on this, Steve, is I've tried the tariffs tool on HMRC's site on gov.uk on a couple of things. I don't know, I mean, I don't want to be too negative, but it's quite hard to match your specific product type to the categories that are in there. So I'm really looking forward, David, to this support unit you're setting up, the Readiness support unit, because I think it's exactly those sorts of questions that helpline or email inbox response will hopefully help with, because we've got a whole load of our members and sector companies saying, for this particular type of product, which is very difficult to find on the database, if I'm honest, that's going to be really helpful if someone else is there to kind of help navigate the database.
Yeah, I mean, I think it would be fair to say that many of the questions that we get that we feel least able to be able to find confident answers to are around tariffs and HMRC approaches. I suppose the good view here is as I believe it, it's the sort of thing that can be resolved through VAT and customs things, we hope, certainly in terms of into the UK, away from the border, and you'll have a period of time to put those returns in. And of course, we don't yet know how the EU would handle tariffs on the way out. So I think this is an area that you're right to focus on, and I apologise for not being able to give you detail. And I'm not sure whether, David, you think your helpline will be able to do this one, or it's one that will fall more to the HMRC. My guess is it becomes an HMRC matter.
Yeah, I mean, it's worth noting HMRC do already have, don't they, David, a telephone number you can call with inquiries. I haven't tried it, but do you think they would give answers if we phoned them on the WTO position on various types of medical products?
I don't think they would be able to give you that on the phone, but the Trader Readiness Support Unit that we're setting up is obviously specific for our sector. So those are the exact type of questions which we hope to be able to provide the answers to. So I think, I don't think the HMRC phone line operators would have that level of detail. So I would try the unit once it's launched next week.
Okay. So sorry we can't answer that question specifically. Some routes to help, and you're not alone. This is a challenge that others are facing on the specifics. Told that we need 2 EORI numbers, but that depends on port of entry, and I thought having more than one is illegal. Can you confirm? Freight forwarders are saying we only need the one when contacted. David, have you been around that one? You're close to the joys of freight forwarding technicalities.
This is another bit of a stretch one. As this is reported and will be held to account for forever, I will take both of those questions away and clarify them, get back to Steve and Michael so they can share a response with all participants rather than have a stab now.
It did come up in Cambridge yesterday, because I'm quite happy to go on the record.
You can share what was said yesterday in Cambridge.
Exactly. So yeah, you can have an EU EORI number or a UK one, but you can't have both at the same time. So the question is, given if you've got an EU one, it won't be valid. You'll need a UK one. As I understand it, certainly what was said yesterday was that you can apply for a UK EORI number even if you've got an EU one. They basically waived that duplication issue. You can lodge a request for a UK one up front on the understanding that you might not need it if we don't exit with no deal. But that process can be initiated now with HMRC. So that was what we heard yesterday.
I think that, again, this is another one which we'll endeavour to add to our list of Q&A, and probably, David, it's useful for the Trader Readiness group to have an answer to this one as they're established next week.
Yes, definitely, they will do.
Yeah, what I would say, I mean, my kind of bottom line response to that, Steve, is there's a huge amount of very detailed information on trade flows on the HMRC guidance pages on gov.uk, and it does go into quite a lot of detail there about EORI numbers. So, we're not experts on it, but the information is there if you can plow through a little bit. I'll have another look myself and see if I can get an answer to that question.
Thank you. I'm conscious that we've kept you for nearly an hour. Thank you very much. Unless there's anything else from anybody, I suggest we thank you, David. Have a good weekend, and we will do this again next week.